Can I Move Mountains? This is a book to read, and it took me time to research, to pray, and to wait on God and look at the scriptures and what Jesus talked about moving mountains. And this book is quite a story, it's quite an inspiration, it is quite something that will change your life. So order your copy today. We can send it to you wherever you are in this country. We will be able to send this book to you on mountain moving faith. Call that number or send a message, and our team will be able to ship it to you wherever you are. There's a book to read. You can also buy for your friend, for a family as a gift, and I have no doubt they will thank you, and they will be always thankful for what you have done for them. So God bless you as you read this book, Mountain Moving Faith.
This is a hospital in Roysambo along Lumumba Drive. We are level 4 facility, SHA accredited.
Cervical cancer is one of the most preventable and treatable diseases of our time, and yet it continues claiming lives in the country. According to a report by Ministry of Health 2 years ago, over 3,240 people are dying because of cervical cancer. Now that translates to 9 deaths every single day. Should we be losing lives because of vaccine preventable diseases? Really? How do we win this battle? We find that out today. Greetings and welcome to the Health U. This is your favorite health program on Faith Day Television, bringing you expert health insights. My name is Enock Kitondekijja, your host. Allow me start by recognizing our distinguished partners. That is JCK Hospital. You can find them in Roysambo along Lumumba Drive, just opposite Park University. They are also in Juja Farm and Maria Ini. Now, JCK Hospital is known for its community outreach and medical missions every now and then, and they're doing a great job. And today is a special day. I am told they are in Juja Farm. They're hosting a very big team from Liberty University. They're going to be offering free medical services. So people in Juja Farm, make sure you go to JCK Hospital. Services are free today. Thank you so much. That is JCK Hospital for you. And of course, tonight we tackle a very critical health issue, which is cervical cancer. Now, this disease is posing a significant threat to women's health. And today we want to know, because we are waging war against this cancer, how do we really save the next generation from it? And today we have an expert in the building, a gynecologist. Simply call him an OBG gynae. So we are going to know what does that mean today. But before I invite him to take us to the next level, I am cognizant of those of you who follow us on social media. Yes, we celebrate you and we recognize you. If you're following us on YouTube, remember to subscribe. Remember to like. Those of you on Facebook, press that follow button. If you have any question, let it come through using the number on your screen. Remember, the earlier you send in your question, the better. Thank you so much. Back to my guest, Daktari. You are welcome to Faith Today Television. For our viewers, would you please introduce yourself fully?
Thank you very much, Enock, for having me. I also want to pass my gratitude to Faith TV for hosting me. My name is Dr. Kiamba Maingi. I'm a senior registrar in Obstetrics and Gynaecology at the University of Nairobi and KNH. I am happy to be here And as we get into this, is that what I say, I want to repeat what Enock said, is that cervical cancer is a tragedy because it is something which is entirely preventable. Thank you.
Welcome. Yeah. How has been your week like?
My week has been okay, up and down as usual. It is still early in the week, but we thank God for the rains. At least it is not as hot as it was before, and it is not as dusty as it was. Although I have developed some flu, and I hope it is not going to interfere with the program.
I'm sure you're going to have a good time because you're dressed for the part, you're dressed for the show.
Thank you.
I can't wait to really learn. And of course, we thank God for the rains. It's been really long overdue, but finally the season has changed, and we really thank God. Daktari, you know, last week we were talking about immunization, vaccination, and then a certain issue came up, cervical cancer, and you know, it's really a challenge. But before we dive deeper, give us an overview of cervical cancer.
Cervical cancer, I want to look at, if you look at it globally, it is registered in around 660 cases, 660,000, almost 700,000 cases per year. And of those, more than half are dying. That you're talking about 350,000 to almost 400,000 women are dying yearly because of cervical cancer. If you look at the distribution or the disease burden, it is unfortunate that we in Sub-Saharan Africa, Central America, and Southeast Asia bear the largest cases of mortality. We're talking about almost 80% of all the cases of either incidents, that is reported cases, and deaths are in majorly Sub-Saharan Africa, Central America, and also Southeast Asia. Yeah, if you look at the figures in Kenya, some studies done in the late 90s, early thousands showed that we were registering, like in Nairobi, we were registering up to 10 to 15 new cases of cancer weekly. That was then. But I am sure the figures have really changed at this point. We are talking of about around 4,000 new cases every year, and more than 3,000 deaths per year. If you look at those who are mostly afflicted by this tragedy, are young women. Interestingly, cervical cancer is one of the few cancers which affect the young women population. We are unlucky to those of us who are here in what you call the Sub-Saharan Africa, because of many socioeconomic and political, even policy issues, that we are bearing the burden of this tragedy.
Yeah, and that is interesting to know, because when you say that it is now affecting the younger population, earlier on we thought that cervical cancer is majorly for the middle-aged, maybe the old-aged. Why is it now showing up in the young population today?
I think it has a lot to do with our also socio-cultural changes, because currently, if you look, okay, just to give a picture, is that the age of onset or the age of onset of engagement in sexual activities has dropped down drastically. Now we have kids who are 12, 13, 14, as early as 10, engaging in sexual acts. 2, because of the improvement in diet and everything, we have our youth or our children getting to puberty earlier than before. Recently, just to relate, in the US, they have realized that the average age has dropped to 10 to 11 years. But initially, we're talking about 17, 18, 19 years. So that change in our bodies, the growing the approach to puberty, and also the socioeconomic status, the foods you're eating, and also the concentration of populations to cities, social media, changing cultures. Young children are engaging in sexual activities earlier than before and are being exposed to the cause of cervical cancer, which we'll talk about later, which is a human, HPV, human papillomavirus.
Yeah. I think that's very interesting to note, because when you learn that now Yeah, our younger people are exposing themselves into this, engaging into this sexual activity at a very early age. No wonder we have, social media everywhere. Information is too much everywhere, and that can be a factor. So help us understand about now, how does someone get to have the cervical cancer? Take us through that journey.
The journey. Okay, so cervical cancer is that we have established now beyond doubt that it is caused by human papillomavirus. Human papillomavirus have been thus since the beginning of time. Viruses have been with us since the beginning of time. Human papillomavirus is mostly an infection which one will get throughout your lifetime. You'll get an infection of human papillomavirus. In most cases, the body, the immune system of the body, using natural killer cells and other immune systems, clears that infection within 6 to 2 years, 6 months to 2 years. It is cleared of the system. But in some cases, there's what we call persistent human papilloma infection. So even after the initial infection, is that instead of the body is unable to clear that infection. So it persists throughout life, and in some people, it leads to development of some diseases. Not what is that. It is not only cervical cancer which can be attributed to human papillomavirus. It is a virus which is found in your skin, your throat, and the genitalia. Even at around your anus. So it has been known to cause penile cancer. It has been known to cause rectal cancer. It has been known to cause oropharyngeal cancer. Even vulvovaginal cancers. So now back to the development of the disease. So once you get exposed to the virus, is that most of the time, 7% of the time, the body immune system clears the infection. But in some cases, it persists. Or there is recurrent infection with the virus, and that exposes you to development of cervical cancer, which is our topic today. We want to center on that. Yeah. So when there is persistent infection of the virus, it is incorporated in the DNA of our cells, and that leads to change in the multiplication of the cells and how the cells behave. Yeah. Cells which are normally the normal multiplication of cells and duplication of cells, where that when cells grow to some certain age, they go what's called apoptosis, some automatic death, and new cells are formed. But when the DNA of the virus is incorporated in the cells of the cervical cells, that whole process is hijacked, and then there is uncontrolled growth of cells. Yeah, that is how the cancer goes on to develop. Yeah. Okay.
Wow. And I like the way you give us now this background, because for our viewers, those of you who are just joining us, we are having an expert, Dr. Maingi here, breaking down for us what cervical cancer really means, where does it come from. And we learned that these days it's really prevalent because of the information that we are exposed to, the kinds of lifestyles we are assuming, and also for the young population because of what they hear, they learn, what they see, and then our socio-economic status. All that combined, you get exposed to this virus, and more so because of early sexual contact. I think that's very, very important. And of course, he has also said that this all because of the even our health, our immunity. We are always exposed to this virus. And the more you expose your body to this virus, the more you increase the chances of it developing into a cancer. So, Dr. help us understand, what are some of those predisposing factors?
Yeah, there are very many factors which influence the development of cancer from the exposure. Generally, is that people whose immunities have not been compromised, the development of cancer is between 15 to 20 years after the exposure to the virus. And now let's go back to the age of exposure. Assuming now that in earlier days, somebody was exposed to the virus, say 19 years, 20 years. So by the time they develop cancer, we're talking about 40s, yeah. In the late 30s, early 40s, or even in the late 30s, 40s. Yeah. That is where that old practice of we are going to screen you for cancer after 35 years. Because the assumption was that from the exposure to the virus to the time you develop the virus, we're talking about 15 years to 20 years.
20 years.
Now, people whose immunity has been compromised, like for example, in the subject of HIV, that latency period drops from 15 to 20 years to actually 5 to 10 years.
Wow, that is
So
good.
if we have an immunocompromised teenager, say 15 years, and they've been exposed to the virus, by the time they're 20, they could actually develop cervical cancer.
Cervical cancer.
Yeah,
And that is
possible.
it's very interesting because we knew that it only happens in the late 30s, 40s, but now having it early 20s,
Yes,
that is really problematic.
It is problematic, and it is. I personally, I have attended to a patient who passed on. I think it was sometimes 5 or 6 years ago, at 21 years, and they came in with stage 4 cancer, cervical cancer, at 20 years. So you can imagine this person was exposed to the virus in their early teens. You know.
Yeah.
So
Dr. Speaking of immunocompromised, those are people whose immune system is a bit low.
Yes.
Who are those kinds? Maybe help us break down that kind of.
In our setting, the biggest here is the biggest factor is HIV. And a few years back, in the late 90s, early 2000s, it was a big issue. It was a big health issue, and then it was compounding with other co-infections. And we came to realize that cervical cancer was among those issues which come with HIV infection, with immunocompromised people who do not take medication.
Yeah.
Especially in the HIV cases. Of course, this case is going to come in very fast, very hot. The progression is very fast. Okay, we have people who are on chemotherapy. Maybe ladies who have cancers, childhood cancers, and who are being treated for childhood cancers with chemotherapy or radiotherapy. We have people who are diabetics. Okay.
Yeah.
Majorly those people on chemotherapy, people who are diabetics, people with childhood cancers, leukemia, and diabetics. Yeah. So in those cases, the progression is faster than the immunocompetent individuals.
Yeah. And I think that's very interesting because now that the statistics are changing, people need to know when does someone really manifest with this cancer at an early, stage, and that is very, very important. Dr. Speaking of this infection, the HPV, we've heard that vaccination or immunization against this virus can help. What do you have to say about the efficacy, the effectivity,
the efficacy
of this vaccine?
Is great. Studies have shown that up to 90% of people who are vaccinated are properly protected from developing the cancer. Remember, we cannot stop your exposure to human papillomavirus. We cannot stop the exposure. It is as sure as tomorrow that you'll be exposed. You, I, everybody has been exposed at some point in life. You can be exposed even multiple times. Okay? But now, what the vaccine does, if you go back to the virus, there are like 100 subtypes of the human HPV. There are like 100. Of those 100, around 15 have been isolated to be associated with development of cervical cancer, and the penile cancer, the anorectal cancer, vulvovaginal cancers. Of the 15, the most virulent, those which are responsible for like 70 to 80% of the disease, are two subtypes: subtype 16 and subtype 18. There's also subtype 9 and 11, which also contribute. But the most virulent are subtype 16 and subtype 18. That's why even in the development of the vaccines, the targets are majorly subtype 16 and 18. But there's also another vaccine. That is, you're talking about what is available in our local market, which targets the 9 and 11.
Yeah.
And 11. Yeah. So we need to advocate vaccination.
Yeah.
Noteworthy is, and I don't know, I'm sure most people don't realize this, and I don't know this, I'm just ignorant about this. Noteworthy is that in 2019, the government of Kenya incorporated cervical cancer vaccine into the KEPI, the Kenya Extended Program of Immunization, for girls who are between the ages of 10 and 14. That is the assumption that these are girls who are not yet exposed to sexual activity and have been not exposed, theoretically not be exposed to the virus. So in Kenya, there's a program since 2019 to vaccinate all girls between the ages of 10 and 14 2 to 3 times.
Yeah.
Yeah.
And speaking of that, I know, yes, they have a strategy, they have a program in place, but we are realizing, you know, we had a show previously, and people were really refusing this vaccine. You call it vaccine hesitancy. I don't know if you have encountered any of these people who refuse, literally refusing the vaccine, regardless of the benefits you've talked about. Why do you think it is happening?
Now, there is, I think, the biggest problem we have when it comes to vaccine hesitancy, especially when it comes to the cervical cancer vaccination or immunization, is information. It's information, misinformation, disinformation, and outwardly ignorance.
I repeat, what is distorting the program is misinformation,
disinformation, and ignorance.
And ignorance.
Yes.
Now, for those of you who are watching this show, this is a moment where you don't want to miss. In fact, you share this link, those of you who are following us on social media, so that we can incorporate more other people, so we can fight this together. It is a war against cervical cancer, and we have a doctor, a gynecologist. It's not an ordinary person. He is combining gyne and obstetrics. He's an expert in this field. So if you have any question, let it come through right away. And I know we are going to have a break in the future. But before we go into this break, let him help us understand now how information is disrupted.
Okay, now let's look at the information. Information about the vaccine is there, but it's not accessible to all people. Okay? It's not accessible to all people. Due to, one, level of education, two, disinterest. Generally just disinterest. Okay? So people are not getting the information the way it's supposed to be. That is one. Two, there's misinformation. Misinformation is that people know something, but they don't present the facts that they're supposed to be. Okay? And this became a problem mostly after COVID. You know, there was the whole hullabaloo about COVID. This thing is supposed to reduce your fertility. This thing is supposed to reduce your life expectancy, whatnot. The same thing is affecting the cervical cancer issue. People are saying, why is it being given to girls? They want to control population. They want our girls not to produce as many children they're supposed to be. They want our women to become promiscuous. They increase the hormones in our girls. So that is just misinformation and also disinformation. Some people are spreading those issues knowingly. That is the difference. There are people who do not know really and are spreading some news or some information without knowing. There are those who are spreading it knowingly, trying to confuse and isolate some populations from receiving these vaccines. Then there's just outright ignorance. If we take a sample of people walking on the street, if we take 10 people and ask them about their knowledge about the cervical cancer vaccines, I can assure you 6-7 will not have an idea. Of those who know, maybe, ask them whether they know that it's provided by government in KP. One might not even know. Okay? And there is the other issue of access. Where can we find these medications? This vaccine? They are available in government facilities. They are available in other, also private facilities. The part of ignorance is a bit tricky because now we have to go back, and I believe that we have the ability, because if you look at the education we received and which was given during the time we had the HIV crisis, even the kids, I then was very young, but I knew about HIV. Okay, because there was consistent and persistent information and education, social education in organizations, in churches, in schools about HIV. So everybody, as I growing up, I knew about HIV. I think the same should and can be done for cervical cancer. Repeating that, it is a tragedy because it is entirely preventable. So I think it is up to us, healthcare givers, media, social institutions like NGOs, churches, to really educate and pass this information the correct way to the intended population. Yes.
And you may not blame the population so much. Allow me pose this question. Is this vaccine safe?
This vaccine is safe as
because it is a drug.
It is a drug, yeah?
And we know that drugs have side effects.
Drugs have side effects. Eh?
So I want to hear it from you, because you may not blame so much people having the hesitancy. You maybe can help us address that fear. Is it safe?
The fear is there, and I understand this fear. Even when COVID came around, people were scared. So many of my relatives and friends would call me, "How is this thing? Have you received it?" And that is where I think the idea of receiving it, I personally received it publicly, and I posted all over my social media to that I am taking this vaccine. It is safe, okay? And of course, a drug has its own side effects or not. But if you look at what we call the risk-benefit ratio, if you look at the risk and the benefit ratio, you will understand why I'm saying that every girl, and actually at some point we think even boys should be vaccinated against the human papillomavirus. Because if you look at the disease process and how these people die and the disease burden, it is tragic. This vaccine is as safe as any other vaccine, and people need to be advised and need to be informed that they need to take their daughters, their young daughters, for vaccination.
For vaccination.
Yes.
Thank you so much. I love the way you are really asserting to the fact that the vaccine is safe, but I also love the way you put it that it is not 100%, safe, just like any other drug. But you also helped us understand that the ratio of the risks to benefits, it's also important factor in that someone gets more benefits than the risks that are involved in this vaccine. Those of you who are just joining us, this is the Healthy You program on Faith Today Television, and we are understanding how cervical cancer is really affecting our population and the impact that the vaccine has towards our health. I know when we were discussing before this show, you told me you had a client who had actually cervical cancer. You diagnosed cervical cancer and you did a procedure. How did you get to get this case, and how is it like?
This is, okay, now let me go to this. This is a peculiar case, and I think we can use this as a case study for actually what's happening with most women. Now, this lady had been having abnormal, I hope we'll get some point we discuss how this disease presents. This lady had been having abdominal vaginal discharge for the last 2 years. She had gone to several hospitals and been treated in, out with antibiotics, antifungals, until somebody told her at one of the facilities, I don't know whether it is proper to Maristops, I don't think it is wrong to mention the Maristops. And then she was advised, we can see that you've been treated for the last 2 years. This discharge is not normal. Something is not right somewhere. Let's do a pap smear. That is screening. And the pap smear showed that this lady had the early stages of cancer. So through my former clients, she was referred to me. I really saw that, and it was urgent. We discussed through the process. I explained her what was happening, what was going to happen if you don't intervene. She was very understanding. And I have to say this, she's not as learned as you'd think, but she is informed in that she knew that if you have this issue, if your pap smear shows there's a problem, you need to intervention, you need to see a gynecologist. So it's not a matter of your level of education. It is just getting the right information and believing in the system and believing in the healthcare system.
I think that's very important, getting the right information
yes,
from the right source.
Yes.
And I'm glad to know that this person was referred to the right person, a gynecologist.
Yes,
Those of you who are just joining us, this is a very interesting story that a doctor here has to complete for us. So you don't want to miss this. I mean, we are going to take a short break, and we will return. We are going to hear the entire end of the story. Did he do the surgery? How are the results? And this is just recent, 3 weeks. Just 3 weeks ago. So you don't want to miss this discussion. Join us in the second part. We are going to talk about more of the screening process, how we detect this early, overcome barriers, and what you are supposed to do today so that we win this war against cervical cancer together. Keep it Faith Today Television.
Okay, asante. Nilikisajili kitabu ambacho kinaitwa 7 Keys to Success, ama kuna kanuni funguo 7 if you like it, ambazo zitakuletea ushindi na kufaulu maishani. Wote, wewe na mimi, tunataka kufaulu, lakini pia kuna njia ya kufaulu. Ukisoma hiki kitabu ambacho nilikiandika kwa kufanya utafiti, kwa maombi mengi, kuangalia neno la Mungu, I have no doubt ya kwamba hiki kitabu kitabadilisha maisha yako. Nilikuwa naongea na mchungaji rafiki yangu akaniambia, nilisoma hicho kitabu, sasa ninafundisha watu wangu kupitia ujuzi, maarifa, hekima ambayo nilipata kwa hiki kitabu. Kwa hivyo unaweza pia nunulia watu wengine, na akaniambia alinunulia hata viongozi wake na wamekuwa wakisoma, wakaweka kwa library yao wanasoma. Hiki kitabu sina mashaka, nina uhakika itabadilisha maisha yako na utabarikiwa. Tuma message ama upige simu kwa hiyo namba na naweza kuwasiliana na wewe na utapata hiki kitabu, utatumiwa, usome na ubariki pia watu wengine. Asante. Mungu akubariki unaposoma 7 Keys to Success, and you will succeed. Thank you.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV. All right, welcome back once again to our second session. We are discussing cervical cancer. It is a war against cervical cancer, and we have an expert in the building, an gynecologist, who is helping us understand how this disease presents, how we can prevent it, and how he is dealing with it currently in the country. He has shared with us a story of how he has worked on a client just 3 weeks ago, a patient just 3 weeks ago, and I'm telling you, the way it presented, if you missed the first part, you can go back and listen closely, but I want him to now take us through the entire story of how he was able to now diagnose the deal, and how is he following up on this client. Is there any hope of them curing from this cancer or getting rid of it completely? Daktari.
So just a small recap. If you can just use this case as a case study, that one, we have to talk about how it presents. So this lady was having abnormal vaginal discharge for more than 2 years. So ladies, you need to be very careful when you have abnormal discharge. It is sometimes you get abnormal discharge because of just regular infections. But if this thing persists for more than 6 months, or you have been treated more than 3 times, please see a gynecologist for screening. If you have abnormal bleeding, meaning that if you have your periods and in between your periods you're bleeding abnormally, if you're having pains in your at your back, in your pelvis, if you're having weight loss, unexplained weight loss, okay, if you're having any swellings at the groin, you need to see a gynecologist for screening.
Groin meaning around the waist area? Around
the waist area, okay. Yes, and in between the thighs.
Yeah.
Okay. So in this case, this patient presented with abnormal foul-smelling discharge from which had been treated for more than 2 years. So what did she do? She went for screening. Okay. So you have experienced some abnormal discharge, abnormal bleeding, all those symptoms. So you go for screening. So screening is basically that you want to look at your cervix and see what is happening here. Okay. So you do what we call a visual inspection of the cervix. That is through a procedure called colposcopy. When you're doing colposcopy, we have some chemicals you can apply to the cervix and see whether there's a lesion. A lesion is an area of abnormal cell when you apply some chemicals, some dyes. So when we see something which is abnormal, we can take a few pieces, called a biopsy, a piece from that area, and take it for cytology. Cytology is when we look at the cells, are these cells normal or not? For this lady, she went for the most common and simplest of screening, which is what we call a pap smear. Pap smear is that we scrape a few cells from the cervix, from the just at the bridge of where the cervix, the endocervix, the ectocervix, just around that bridge, you scrape a few cells, we apply them on a slide, and then we take it to the pathologist who are going to check and see whether they are abnormal cells. When you realize they are abnormal cells, then we know that there's a problem. Okay.
So in this lady, how did you do it?
A pap smear.
You did a pap smear.
A pap smear.
And you're able to understand now this is real cancer.
This is cancer. We had what we call CI1.
Okay.
So this is cancer which is within the cervical cells.
Yeah.
Okay. Then we went ahead and did something called a biopsy to confirm how bad is this cancer, what type, because there are two types. There's what we call adenocarcinoma and squamous cell carcinoma. She had squamous cell carcinoma. Mm-hmm. Then we knew now that this lady is in the very early stages of cancer. This cancer has not spread. This lady now, screening, the other thing you can actually test for the virus itself. It's called a PCR. But testing for the virus does not necessarily mean that you have the disease. As I said earlier, this virus it is cleared by the body within 2 years. But when it comes to the matters of the cervix and cervical cancer, the best thing is getting cells from the cervix and do what we call cytology. When you find that they are abnormal cells, there are different ways of managing this issue depending on the age of the lady. She attained a desired family size in terms of children. Is she immunocompromised? Okay. What is the stage of the disease? So from there you can do a lot of interventions. In the ladies who come early and probably they have not had their children, they still want to do their children, we do what we call a localized elimination of the disease. This you can do by 3 ways. We can burn them, what we call ablation. We can burn those bad cells and then follow up after 6 months. Do screening again to make sure that it is not developing. We can do what we call cryotherapy. This is cold treatment. Yeah. We use liquid nitrogen to kill those cells with very, very, very cold nitrogen. Then there's what we call LEAP. LEAP is we look at where the cancer is, where the cancer cells are, how they're distributed, and then we excise that part. This we do when we want to preserve the cervix, because this lady has to have some babies in future. Okay? And after that, we advise you to have babies as soon as possible, because you don't know when this thing is going to strike again. Because you have to understand, for you to develop this, it means that you have had persistence HPV infection. You have not removed the infection. The infection is still in you. So you can still develop cancer cells
when you continue exposing.
Yes, in future.
Yeah.
Okay.
Yeah.
So in my patient, the case of my patient is that she had, luckily enough, that she had attained, one, she had good information.
Yeah.
She went to the right person.
The right person, yeah.
And she understood. We sat and discussed.
Yeah.
You have had X number of children. Your last born is X number of years.
Yeah.
You are X number of years, or your age is X number of years.
Yeah.
You do not desire to have any more babies. So she said, let's remove the whole thing. Eh?
Yeah.
So that is a surgery where you remove the uterus plus the cervix. So that lady, what we're going to do for follow-up is that what was left, the stamp, we're going to screen it after 6 months and after 1 year. If you establish there are no cancer cells, then she's going to live her life.
Wow.
Yes.
So that means in case you establish there are no more cancerous cells, this person is declared free from cervical cancer.
Free from cervical cancer.
Wow.
Yeah.
We have some questions coming in. That is why I wanted you to answer them. For our viewers, thank you for joining us. This is Face the Television. Remember, as you send in your question, do not forget to indicate your name and where you are watching from, so that we can help follow up and make sure you get the right information. He has talked about misinformation, disinformation, and distorted information, everything around that. So we want you to get the right information. I'm a father of young daughters. At what age should they get the HPV vaccine, and is it 100% effective?
We said that every vaccine has its failure rate, but this thing is 99 is effective in preventing development of cervical cancer. So we insist on vaccinations between the ages of 9 and 15. The best time is just between 10 and 14 years, when these children have not been been exposed to any sexual contact. Because remember, this virus is introduced to the cervix through sexual contact. Okay?
Yeah.
So the idea is to vaccinate these ladies, these girls, these young girls before they're exposed to sexual activities. So between 10 and 14 years, they should go for the vaccination. The vaccinations we have two types. We have the Gardasil and Cervical.
Yeah.
Gardasil we do at 0 at contact, 2 months and 6 months. We are done. Cervical we do at 0, 1 month and 6 months, and we are done.
Wow.
Yeah.
That is your answer, Daddy, over there. Are there free or affordable cervical cancer screening services?
They are free. They are free. We when we have the cervical cancer month, most hospitals, even the very high end hospitals, the Aga Khans, the Matters, and what have you, the Nairobi, they do it a very subsidized price of I think 1,000 shillings. If you go to public hospitals, the cost is much less, much less. The skill is the same. We are the same people. The skill is the same. The results are still the same. We need to trust our healthcare workers. We need to trust the system, especially when it comes to diseases we want to prevent.
Yeah. I think that is very important because, parents send their kids to school and you don't know what happens out there. So it's important for you to be proactive and take caution. Jonte in Roysambu says, Jonte, I hope I mentioned it right. We hear about vaccines and screenings, but what about us men? Don't we also carry the virus?
Yes. If you go back to earlier in the program, that I said that the HPV vaccine, HPV virus, has been known to cause penile cancer, anorectal cancer, oropharyngeal cancer. Okay, and for men, especially those who smoking is another very significant risk factor to development for development of cancer from HPV infection. So for men, some countries actually are vaccinating boys too. But I think because of policy and also I think economic issues, we are not able to incorporate boys. But I want to believe that in the future it is something which is going to be possible. If you can afford, why not take your boy for? It is entirely possible. It is practiced somewhere else. Only that in our program we first targeted the young girls, seeing that the burden of cervical cancer is affecting our young women, and it is far-reaching to family and also economic issues when our young women are brought down by cancer.
I'm enjoying the discussion, and I want to thank you, Dr. for giving quality info here. I want also to understand for someone who's, very many miles away, who can't even access you right now, they can only get this benefit of Faith Day Television. What if I don't have the money? What do you advise me for now?
If for young men, we go to the basics. The basics like we did in HIV. Remember, the transmission of this virus is similar to HIV. So you go back to the basics. Abstinence for young men. Be faithful to one partner. Use condoms. Okay? Circumcision for men. Okay? So we can go back to the basics because the transmission is almost the same as it is transmitted sexually. So we go back to the basics. And another thing is, people, you have to understand is that another thing which is leading to this rise in these cases is multiple sexual partners, because you are exposed to different strains of the virus from different people. Wow. If you have like 3-4 partners, my other partner has 3-4 partners, my other partner has 3-4 partners, you can imagine at the end of the day you're talking about 20 something strains you are being exposed to so many strains. So the more the risk factor. And you see, the other thing is with this virus is that when you have sexually transmitted diseases, especially chlamydia, it's a silent STD, sexually transmitted infection. When you have chlamydia, your chances goes up. When you have HIV, your chances of developing cancer increase 6 times to a person who does not have HIV. So when you practice safe sex, as you are preventing yourself from contacting HIV, you also prevent yourself from being exposed to viruses which may lead you to developing cervical cancer. Yes.
And you will bear with our guest's language. He is an expert. He's a professional in this. That is why he's very direct to these words. But I think also that is why I commend the church, also the clergy. They have done a very good job. I think Bible is relevant in this time, because when they say do not have,
Yes.
sex, do not, go around, sleep around, promiscuity. They are saving us from very many things, So for those of you who are following us, he tells us, bottom line, abstinence is very important. In the church, we say no sex before marriage.
Yes.
And when you get this, people get it in various ways, but you risk being judged when you have cervical cancer at some point in life. But it's very important. The message is out there, so do the needful. We have Quinta from Thika. Quinta, thank you for following us. She says, my husband say the HPV vaccine can cause infertility. Ni ukweli?
No, that is the misinformation or disinformation which is being spread around this vaccine.
Yeah.
And it is rather unfortunate. And it is good to ask. I always say that when you ask, you don't know. But once people might judge you, how do you judge? But once you answered, you're no longer ignorant. So it does not cause infertility.
Yeah.
It does not cause infertility at all. So it is safe for young girls to be vaccinated.
It is safe for young girls to be vaccinated.
Yes.
All right. Quinta there. We have Doc. Does faithfulness reduce the risk of cervical cancer?
It does. And I will repeat this because you see, as is in the case of HIV, is that the more you're exposed, the more sexual partners you have, the more exposed you are to different strains of viruses. Remember, I said that from the beginning that there are hundreds or so strains, but the ones which we have selected for cervical cancer specifically are 15, with 16 and 18 being the most virulent and responsible for around 70%. So the more partners you have, the more exposed you are to different strains, the more chances of you developing the disease. And as I said earlier, ABCD, abstain, be faithful, use a condom, circumcision for men.
Good. Very
the other important thing is screening.
Yeah.
Screening.
Speaking of screening, Daktari, what are the recommended methods of early detection for cervical cancer currently?
One is what we call routine screening. We recommend that women at 30 should have at least their first pap smear. Okay? If nothing is suspicious, can be repeated after 3 years. Okay? Women who are HIV positive should have their first screening at 25 years. Repeated in 6 months, then a year, then after that, every 3 years. That is if they are compliant to their medication. Okay? If they are compliant to medication. But I personally, generally, I advise women to have at least a screening every year. It is not painful. It is just a little bit uncomfortable, but it is not painful. And that screening gives you peace of mind. And if at all there's something, we see it early. Okay? We see it very early. Remember I said that it takes up to 20 plus years for these things to develop. So women need to go for screening. And I'm not saying this for women who are just 30. If you are in a situation where you're compromised, if you started sexual activity at a very early age, you can go for screening. Okay? Screening is the best time. It can be done at whatever time in your cycle, but the best time is mid-cycle. Okay? Yeah.
Wow. You are getting quality information from none other than Dr. Maingi Christopher. He is a very genuine gentleman with his information, and I'm sure even after this discussion, there are those who would want to really contact you personally. I am sure you are open to share so much information. We'll be sharing with you his number if you really want to have a deeper conversation with him. But we really appreciate the conversation. For our viewers, this is a good thing. We have more questions coming in today. I hope that we answer every single one of them. We have Chloe here in KU. Interesting discussion. What are the early symptoms so we can start checking ourselves? I think that's the question.
So as I said earlier, the earlier symptoms are abnormal vaginal discharge, abnormal bleeding. Abnormal bleeding, we are talking about, especially for young women, contact bleeding. Contact bleeding is when after sexual intercourse, you realize that you're spotting. Okay? That is abnormal. You're not supposed to spot after sexual intercourse if you're not in your periods. So abnormal bleeding is a commonest, in tandem with abnormal pervaginal discharge. Young ladies, if you've been treated for a UTI or what you call UTIs or an STI for more than 3 times within 6 months, within a year, and you're still getting that full discharge, please go and see a gynae. Let's check that cervix.
Double click on that.
Yes.
I know
if you've been treated
yes,
more than 3 times with false smelling pervaginal discharge and are not getting any resolution, please go see a gynae. Something else might be happening down there.
That's very important.
Yes.
Daktari, we want also to know, despite the availability of these vaccines and screening services, I know you've talked about misinformation, but cancer still remains prevalent. What barriers do you think are there, and how can we really go break these barriers?
Now, interestingly, let me give you a figure. When the vaccine was launched in 2019, now the expanded. A recent study showed that we just have around 26% or so of girls have been vaccinated. That is a very low number. That is barely 1 in every 4. And you see this is available. It is very disappointing. It showed that girls who are born of healthcare givers had higher uptake. Because my assumption is that, okay, it doesn't, I mean, what I draw from that is that these healthcare workers understand more, and probably they know the benefits more than the other population. So I think the challenge is communicating.
Yeah.
And as from the beginning of the program, I said it is possible because we did this with HIV and it was very effective. The communication, and if there was an issue, social health issue, which had a lot of problems with misinformation and stigma, was HIV. But this slowly people came to appreciate the information and got the true picture of the issue. So I believe it is still possible with cervical cancer.
Yeah. Then there is a question here. How can community and the healthcare providers work together to overcome some of these challenges?
We have to be intentional.
Yeah.
We have to be intentional. And I think we call upon. I call upon also my fellow healthcare workers, gynecologists, everybody. Every time you go to a meeting, every time you go, if you're a nurse, if you're a female doctor, you go to a chama. Every time you go for a rambe, any gathering, please talk to women there. Insist on screening. This church organization, I know most of the church organizations, like a church I attend, we have women.
You also
seminars.
Go to church?
Yes, we have women. Wow. I go to African Baptist Church.
Okay. That's interesting.
In Nairobi, I go to Magadana.
Okay.
Huko nyumbani, I go to a different one.
Yeah, I go to OFC. Yeah.
So we need to all the social gatherings. Gatherings. We need to insist that women need to go for screening. If you see how these affected women die, it is miserable, it is tragic, and it is preventable. Please, let's do screening. Let's inform women in every opportunity which presents. Inform. If you meet 3-4 women sitting together, ask them, have you been screened? It is not offensive. Then I think it is queer, but it is a good thing. You're asking very, very, very pertinent questions.
Yes.
And
I think that's very important because we need to be intentional about our health.
To be very intentional.
Now that you've given us a very big percentage, you said over 50% people succumb after being, diagnosed.
More than actually, we're talking about, and you see, if in our situation, actually, let me talk about Kenya. The screening is less than 5%.
The screening is a bit low. And you see now that we are bearing the burden of 80% worldwide. When we talk about the Sub-Saharan Africa, Central America, and Southeast Asia. Yeah.
If you go to Europe and the West, they bear around 20% of the burden.
Yeah.
But the screening is above 40%.
It's a bit higher.
Very high. We talk about 5 and 40.
Yeah.
That's 8 times more than. So if we could screen more and detect this disease earlier, we would have less mortalities because of
less mortalities.
Yes.
Thank you so much, Doc. That is very interesting discussion. You're learning so much. In just 1 minute, would you give your parting shot to our viewer?
My parting shot is that cervical cancer is entirely preventable, and every woman who dies of cervical cancer at this day and age in a society, it is a tragedy because it is preventable. We need to do screening of our women. Please, 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 please pass this information to your friends, your chamas, your church gatherings. Please let women go for screening. For those of us who have young children, please, 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 let's dedicate some time to educate our children about sex early enough, such that we prevent them from engaging sexual activities when it is too early. For those of us with daughters, please make sure our daughters are vaccinated before they turn 14 or before they are exposed to any sexual activity. That you'll have done the next generation a very, very, very big favor. Thank you.
Well, thank you so much, Dr. Maingi. That is very insightful, and we are so honored to have you on the Healthy You show. It's very quite engaging. And for our viewers, thank you so much once again for following this discussion. And we all know now it's clear that vaccination is very key here. Screening is very important. And then engaging with the community. Let's share this information. Let us get the information from the right sources. Gynecologists are trained for that to help you deal with this. He has talked about this cancer. It can be treated, it can be prevented, but more importantly, it can be prevented. So it's important that you get the right information and take the necessary steps for you. My name is Enock Kitondekijja, and this is the Healthy You. As we always do it, it's our culture. We remember to pray for you who are following us in the hospital. You are catching this at home and you're under any form of treatment. We want to let you know that the doctors who are treating you, we believe they are an extension of God's healing hand. And we pray that may your healing come forth speedily. May you win this fight. May you win this battle that you are going through right now. Until we meet next time, stay proactive, stay informed, and stay safe. God bless you.
This is a hospital in Roysambo along Lumumba Drive. We are level 4 facility, SHA accredited.